The transgenders, they are having an incongruence between their sex assigned at birth and gender experience. As for the DSM, gender dysphoria is explained. It is replaced the term gender identity disorder in DSM-4. Acharya Charaga mentioned the term Vyamislinga, and in other classics also there are references about the Napumsaka. Global prevalence of transgender is 0.2 to 0.5%. They are suffering from discrimination, harassment, and social stigma. Transgender survey in 2014 by Government of Kerala estimated that 25,000 transgenders living in Kerala. Global health and disease of transgender not studied well, but there are reports that there are many psychological issues among this community. So there is a need of by Ayurveda and yoga in this study was planned. This is the research question of the study, the prevailing psychological problems in the community and about the scope of Ayurveda areas. The primary objective of the study is to identify prevailing psychological burden of transgender community and to assess the effect of selected yoga protocol on perceived stress. To assess the sattva and assess the effect of yoga protocol on quality of life also was the where the this was the hypothesis. Methodology includes two steps. They are the one cross-sectional survey and the other one is an uncontrolled clinical trial on selected yoga protocol. For the cross-sectional study, a stratified random sampling was performed, and for that the entire state is divided into three zones: Zone 1 and Zone 2 Central Zone and Zone 3 North Zone. And for the cross-sectional survey, 93 was the sample size, and for the uncontrolled clinical trial, a subsample of 24 was taken from the main sample. This was the inclusion and exclusion criteria. Stress level above 13 as per the PSS, perceived stress scale, is taken for the inclusion. Materials includes Kessler Psychological Distress Scale for assessing psychological distress, DAS-21 for assessing psychological screening, Cohen's Perceived Stress Scale for perceived stress, Sattva Assessment Scale is used for assessing Sattva, and the WHO Quality of Life, BREF, was used for assessing quality of life. Since all the data, they were following normality, student t-test, pair t-test, and RM ANOVA were chosen for the analysis. Observations, analysis, and discussion is the next session. Then cross-sectional survey, phase 1. As per the observation, 57% of the participants belong to Zone 1, 17.2% belong to Zone 2, and 25.8% belong to Zone 3. Most of the participants, they don't have permanent domiciliary status. As per the previous study also, it was observed most of the transgenders living outside their home due to gender identity issues. And about the occupation, unemployment is 20.4% among this community, and unemployment, ill-paid job, and inconsistency in the job lead most of the participants into commercial sex work. Education status: high school education was attained by 55.9% of the participants. 35.5% of the participants were graduates. The situation was improved after the transgender policy in 2015 by Government of Kerala. Marital status: 66.6% of the participants were unmarried, while 20.4% of the participants were married. 55.7% living with their partner. Marriage is not a legal matter in this community. Many of them living with their partner to whom they were not married, and the partner may be either a cisgender or a transgender. Mental status examination was done. 23.7% of the participants were anxious and 18.3% were sad. And memory is affected in 26.9%, and recent memory is affected in most of the participants. Sleep was disturbed in 38.7% of the participants. Habits and addiction: 14% of the participants were having addiction for smoking. Narcotic and alcohol addiction in 11.8% of the participants, and many of the participants were addicted to cannabis, MDMA, and other synthetic drugs. Health problems are seen in 87.1% of the participants. They include rheumatic spectrum disorders, diabetes, depression, anxiety, insomnia, etc. These also stand in accordance with the previous studies by Sari S. Reisner, Sumita T.S. and the Transgender Survey in 2014 also. 24.7% of the participants were having a history of previous psychiatric illnesses. And suicidal ideation is in 37.6% of the participants, and 20.4% of the participants have suicidal attempts. These also stand in accordance with the previous studies. Transgender survey in Kerala that says 32% of the participants were attempted for suicide at least one time in their life. Sexual orientation, 87.8% were oriented towards man, and 11.1% were oriented towards women. Current social situations. Most of the participants have unsatisfactory family life and unsatisfactory social relations, and the economic situations are also very bad. Manasa Prakriti was assessed, and 43.3% were Rajasa Prakriti, 27.8% Tamasa, and 28.9% Rajasa Tamasa. And as per the Kessler psychological distress scale, it was observed that 41.9% have moderate disorder, and 12.9% were having severe psychological disorder. DAS 21 says 54.8% having moderate depression and 40% having severe depression, and 49.46% having moderate anxiety and 13.98% having severe anxiety. Stress is seen in 45.2% of the participants as moderate level, and 14% participants having severe stress. Cohen's perceived stress scale says 98.9% having moderate perceived stress. Sattvabala was assessed, and it was seen that 39.8% having Pravara Sattva and 58.1% having Madhyama Sattva, 2.2% were with the Avara Sattva. Now we are moving to the uncontrolled clinical trial. At the beginning of the intervention, the perceived stress was 18, and it reduced to 11.75 at the end of the intervention of 1 month, and on the follow-up, it was seen that the perceived stress level raised up to 13. Effect of yoga on perceived stress. Pairwise comparison of total score using perceived stress scale, the results was observed that the results were significant at the level of p-value less than 0.001 in RM ANOVA throughout the study. Effect of yoga on quality of life. Quality of life was significant in all domains throughout the intervention period at the level p-value less than 0.001, and significance was not retained on follow-up. Probable mode of action, yoga effect on sympathetic system, sympathetic nervous system, HPA axis, and it reduced the cortisol level. Summary of the study. A cross-sectional survey was conducted to identify the psychological burden of transgender community. 61.4% were with moderate to severe stress, 67% were with moderate to severe anxiety, and 74.2% with moderate stress. And selected yoga protocol have significant effect on perceived stress and quality of life, and 58.1% were having Madhyama Sattvabala. This is the conclusion. Selected yoga protocol is having significant effect on the participants, hence my alternative hypothesis accepted. Recommendation: controlled clinical trials on Yukti Vyapasraya and Sattva-Jaya modalities may be planned in future, and necessary policy changes to address the issues regarding the treatment of transgender people in our system, that is also to be considered very seriously. This is the need of the hour. So these are my references. Thank you very much.
Next contestant 2, please get ready. Contestant number 2.
What were the selected yogas you have done?
Sir, the selected yoga protocol that is conceived by the Department of Ayush and Health Department at the time of International Yoga Day in 2019, and it includes Shwasana Vyayama, Asanas, Pranayama, and relaxation. These are the major steps in that. It includes some asanas also.
Among the classification I had seen, except Sattva, Rajas and Tamas were there.
Yes, sir.
What was the percentage of Sattva in that?
Sir, it's also there. Shall I say that because the sattva and rajas and rajas tamas and rajas tamas were the they were seen. Sattva is not seen.
Okay, Dr. Subhash, it was an excellent presentation. My question is, why did you choose this topic as your study subject?
Actually, sir, now lot of changes happening in our social level, and many health issues from the vulnerable community across the Kerala that is coming into the attention now. So, while considering the various studies and our intervention by Ayurveda that is very limited in this area, so to make Ayurveda more progressive and more accessible to all the vulnerable population, that is the need of the hour, then only Ayurveda can become rise up to into the sphere of social justice. That is why I selected this topic.
Thank you.
Thank you, sir. Thank you.
Contestant number 2.
Good morning all. Welcome to a case presentation. Today I am going to present a case, schizophrenia, Ayurvedic management. This is a case which is admitted in our hospital. Introduction. Schizophrenia is a common severe mental illness. Common features are delusion, hallucination, disorganized speech or behavior, and impaired cognitive ability. It affects approximately 24 million people around the world, almost 0.32% all the worldwide. Treatment, in that treatment, antipsychotic, antidepressant, mood stabilizers, group of medicine, generally we are taking. In Ayurveda, it is come under Unmad spectrum of disorder. Here, a 27 years male coming from Hindu background, he is a graduate. Informants are his parents. Common complaints according to patients are lack of concentration, hearing sound of family members and relatives, getting smell of kumkum, basma, tulsi without stimulus from last 2.5 years, increased sleep and mood swings also noted. According to informant, self-talk, self-muttering, staring vacantly, sitting idle, decreased communication with parents also noted from last 2.5 years. History of presenting complaint, he was born through IVF method. He was a premature baby. Mother believed that his birth resulted from prayer to Santan Gopala. He had seen Subramanian Swami at the age of 3 years. He had a strong interest in religious ritual and prayer and practiced vows from childhood itself. Interpersonal relationship with family members were not cordial. According to him, during COVID time, he felt under stress and auditory hallucination was started, influenced by religious things like kumkuma, basma. He heard commanding voices. He used to like loneliness. He treated with allopathic treatment and was under counseling. Family history was not relevant. Treatment history, he was admitted in Kozhikode under a psychiatrist. He is taking allopathy treatment in which schizoprene, Parkin, Clozet, Carnia, antipsychotic medicine was given. Presenting history, he is vegetarian, appetite reduced, bowel is regular, micturition was 4 to 5 times per day, sleep was increased. He was addicted for ganja, alcohol from last 3 years during his college time period. Vitals are normal. Coming to mental status examination, general appearance and behavior, grooming and dressing was well groomed, facial expression suspicious, eye contact was staring, attitude toward examination was cooperative but guarded in nature, comprehension was slightly impaired, gait and posture no abnormality found, motor activities decreased, social manner no abnormality, rapport was established but with difficulty, speech was coherent and relevant, spontaneity of speech not spontaneous, Rate and flow was slow, quality of speech was paucity of content, tone was dull, tempo was slow, volume was low, mood and affect was sad, process is slow, perception, hallucination like auditory, visual and olfactory, all kind of hallucination was noted. Cognition, he was alert during the interview, he was oriented to time, place and person, attention and concentration was impaired, intelligence after thinking, reading and writing capacity, visual spatial ability was intact, insight was grade 3, judgment, taste judgment and personal and social judgment was intact, impulsivity was absent. Coming to Ayurvedic psychiatric examination, Manovibrama was present due to anxious thought about future. Buddhi Vibrama also present, as we see that hallucination was found. Bhakti Vibrama was present, increased activity related to religiosity, more belief in religious ritual. Chesta Vibrama was present, reduced motor activity, trouble with daily chores. Achara Vibrama was present, reduced personal and social hygiene. Dashavita Pariksha Dosha was Kaphavata, Dhatu was Rasa Rakta Medasa, Bhumi Sadharana Desha, Rogabal was Pravar, Rogibal was Madhyama, Kalakshanadi was Sharada, Anala was Manda, Prakruti, Deha Prakruti, Vata Kaphas Prakruti, Manasik Prakruti, Tamasik Rajasika, Vaya was Madhyam, Sattva Avara, Satmya, Madhur Katuras Satmya, Ahar Shakti, Abhiran Shakti was Madhyam, Janan Shakti was Avara. Lakshana according to Unmad spectrum, Kaphaj Unmada, this Lakshana is noted, Sthan Ek Deshta, Alpa Chankramana, Saucha Desha, Swapna Nityata, Ras Kamta, Mandavak Cheshtita, Annala Abhilasha, Vata Unmad, Chanchal Chittatam, Ati Chinta, Twak Parusha. Diagnosis was schizophrenia. According to Ayurveda, Kapha Junmada with the Vatanubandha. Internal medicine was given like Brahmi Dakshadi Kasaya, Kalyanaka Grita, Ashwagandha Shweda Shankpushpi Kushta Churna, 5 gram 2 times after food. Treatment was given. Virechana is given on the first day with Havipati Churna, 30 gram with lukewarm water in morning. During observation, 6 Vega was noted. Udvartana with Trifla Churna, Snehapana with Kalyanaka Gruta for 2 days. Abhyangushmaswed with Eladit Era for 2 days. Virechana was given Ichabidi 2 tablet plus Patol Katurvani Adi Kashai 60 ml. Nasya was given with the Hingu, Vacha, Daru, Haridra kind of Tikshna Darg. Dhupana was given with Haridra, Vacha, Jatamasi, Kushta, Darvira during the full course of treatment. Takradhara was given with Musta, Amal ki Takra. Yoga therapy was given with Nadi Shuddhi Pranayam and relaxation techniques during the full course of treatment. This is a positive and negative syndrome scale which is taken in consideration for schizophrenia symptoms. Before treatment it is 83. After treatment we notice it is 49. Intensity of auditory hallucination was reduced. Start and mingle with parents. Quality of sleep was improved. Self-talk and self-muttering also reduced. Discussion. Kaphavadaj Unmada in this case we noted. Initially Virechana is given for Koshta Shodhana and also to reduce the aggressive symptoms. Snehapana with Kalyanaka Grita was given before Shodhana.